Did you know that more than half of women do not bleed the first time they have sex? Many people believe that bleeding must happen the first time. But according to medical science, that belief is not true. Today, I will explain the real medical facts behind this common myth. Hello, I'm Dr. Emily Carter. Today we are talking about the hymen, something many people mistakenly call a seal. There is a lot of confusion about this topic. So, let's clear it up using science. First, let's answer an important question. Is bleeding necessary the first time someone has sex? The answer is no. Bleeding is not required. Medical research shows that more than half of women do not bleed during their first sexual experience. Every body is different. Bodies respond in different ways. And that is completely normal. Now let's talk about the biggest myth. Is the hymen really a seal that must be broken? No. The hymen is not a plastic cover. It is not a closed wall. And it is not something that must be broken. The hymen is a thin, soft, flexible piece of tissue located near the vaginal opening. Most hymens already have natural openings. If they did not, menstrual blood would not be able to leave the body during a period. So medically speaking, the idea of a sealed vagina is incorrect. Where exactly is the hymen located? The hymen usually sits about 1 to 2 centimeters inside the vaginal opening. It is delicate and flexible. Its size, thickness, and shape can vary from person to person. Some hymens are very thin. Some are thicker. Some stretch easily. Others have larger natural openings. In some cases, girls are even born with very little hymenal tissue or none at all. This is completely normal. Now let's talk about what may happen the first time someone has vaginal sex. There are several possibilities. The hymen may gently stretch. It may develop very small surface tears. Or sometimes nothing noticeable happens at all. There may be no bleeding. There may be no pain. And this is medically normal. Part 6. Changes without sex. Here is another important fact that many people do not know. The hymen can change even without sexual activity. Over time, everyday physical activities can stretch or thin the hymen. For example, cycling, running, dancing, gymnastics, sports, horse riding, using tampons, or accidental falls. Because of this, the presence or absence of bleeding does not prove anything about someone's sexual history. Bleeding is not a reliable sign of virginity. And if there is no bleeding, it does not mean anything is wrong. Some people also wonder about physical sensations. During a first sexual experience, some women may feel mild discomfort. Some may feel slight stinging. Some may notice light pink spotting. But many women feel little to no discomfort at all. Pain is not required. Bleeding is not required. If pain does happen, it is often related to other factors, not the hymen itself. For example, nervousness, anxiety, muscle tension, lack of lubrication, not feeling emotionally safe. When a person feels relaxed and comfortable, the body responds naturally. The pelvic muscles relax, which helps reduce discomfort. Communication and consent are very important. Now let's answer another common question. Can someone check their hymen at home? A person may try to look using a clean mirror in a private and comfortable position. However, it is important to understand something. Hymens look different for everyone. Even trained medical professionals cannot always determine sexual history based on appearance. In fact, major medical organizations clearly state that virginity cannot be proven through physical examination. There is no S. If this video helped you learn something new, consider sharing it with someone who still believes this common misunderstanding. In the next video, we will talk about how to reduce discomfort the first time and what safety steps people can follow for a healthy and responsible experience. Stay informed. Choose facts over myths. And respect every body. Lack of lubrication. Or not feeling emotionally safe. When a person feels relaxed and comfortable, the body responds naturally. The pelvic muscles relax. This helps reduce discomfort. and makes the experience smoother. Communication between partners is very important. Consent is also essential. Now let's talk about another common question. Can someone check their hymen at home? A person may try to look using a clean mirror in a private and comfortable position. However, it is important to understand something. Hymens look different for everyone. Even trained medical professionals cannot always determine sexual history based on appearance. In fact, major medical organizations agree on this. Virginity cannot be proven through physical examination. There is no scientific test that can confirm it. The hymen is simply a small piece of body tissue. It is not a record of someone's past. In many cultures, myths about the hymen have created unnecessary fear, pressure, and shame. But medical science tells us something very clear. The hymen is not a character certificate. It is not proof of purity. And it is not a measure of morality. For partners watching this video, this is also important to understand. Bleeding is not an achievement, and it is not something anyone should expect or demand. A healthy first experience depends on several things: mutual consent, trust, emotional comfort, clear communication, and patience. When both partners feel safe and respected, the experience is usually much smoother and more comfortable. Healthy relationships are built on trust, respect, and understanding. No